You've done this today, and it could have landed you in a hospital bed. Felt the tickle build somewhere you couldn't let it rip. A meeting, a classroom, a first date where sneezing felt like the single most embarrassing thing that could happen to you. So you shut it down fast, pinched your nose, clamped your jaw, held your breath until the urge just disappeared. You called that being polite. Somewhere in England, a doctor would call it something else entirely. The reason a grown man spent an entire week in a hospital bed from a sneeze that never even happened. Here's the thing about a sneeze. It's not a suggestion. It's your body's emergency eject button. Your nose detects a threat. Dust, bacteria, pollen, and in response, your chest, throat, and diaphragm all fire at once to blast it out with real force. It's less achoo and more a small, coordinated explosion happening inside you, on purpose, for your protection. There's an actual command center running this whole operation, tucked in your brainstem, coordinating your lungs, your throat muscles, even your eyelids, faster than you can consciously override it. That reflex has been keeping mammals alive for millions of years. It does not know what a silent job interview. It does not care. Quick, honest question for the comments. Do you pinch your nose to stop a sneeze in public? Be honest. Most people do, and most of those people have no idea what they're actually fighting when they do it. This isn't a warning label nobody reads. This actually happened. A 34-year-old man walked into an emergency room in England, healthy, no accident, no fight, no fall, nothing that sounds remotely dangerous. He just tried to stop a sneeze. Before we go any further, take a guess. What do you think happened to him? A nosebleed? A burst blood vessel in the eye? The kind that sometimes shows up after a violent sneeze? Hold that guess. You're going to want to check it in a minute. Let's rebuild the moment, piece by piece, the way his doctors eventually had to. He feels the tickle. He's somewhere he can't let it rip, so he does the classic move. Pinch the nose, clamp the mouth shut, hold it all in. Then, a pop. Not a normal pop. One he could actually feel, deep in his neck. Almost immediately, something's wrong. Swallowing hurts. His voice sounds off, muffled. His neck starts to swell. And when he moves it, there's a strange crackling sensation, like something is shifting just underneath his own skin. That's when he heads to the ER. At the hospital, Leicester Royal Infirmary, to be exact. Doctors press on his neck and hear that same crackle. In medicine, that sound has a name, and it's not one they take lightly. They send him for imaging. The scan shows something nobody in that room expected. Tiny streaks of trapped air, threaded through the soft tissue of his neck, tracking downward toward his air, sitting under his skin, somewhere air should never be. So, if you guess nosebleed or a burst vessel in the eye, you're not even close. This man had torn a hole on the inside of his own throat. Here's the part that actually matters, because it's not really about him. It's about anyone who's ever done exactly what he. Picture your airway as a fire hose that just got switched on full blast. That's a sneeze. A short, violent release of pressurized air with exactly one job. Get out, fast, through your nose and mouth. Now picture plugging both ends of that hose while the water's still running. The pressure doesn't vanish because you blocked the exit. It has to go somewhere. In his case, it found the weakest point available, the wall of his own throat, and blew straight through it, forcing air into the surrounding tissue instead of out into the room. Doctors actually have a name for what was trapped in there. Air forced into the tissue under the skin, where it never belongs. And the injury wasn't a total mystery to them either. That same kind of tear shows up, rarely, coughing fit. Anything that spikes the pressure in your throat with nowhere clean to release it. A blocked sneeze, it turns out, belongs to that same dangerous family. His doctors recognized the pattern almost as fast as they saw the scan. And he isn't even the only strange case on record. Doctors have also linked this exact move to burst eardrums, and in one separate case, to a fractured bone buried deep inside a man's ear, snapped by the shockwave of a sneeze he tried to swallow whole. Same basic mistake, different weak point in the body. Back at the hospital, this stopped being a funny story fast. He couldn't safely swallow with a torn throat, so he was fed through a tube. He was started on antibiotics because that trapped air wasn't just uncomfortable. It was a potential doorway for infection to spread toward his chest, which is a genuinely serious complication if it's left untreated. That space behind your ribs, between your lungs, is packed with your heart, your major blood vessels, your windpipe. It is not a space where you want stray air or a stray infection setting up camp. Doctors kept him under close watch specifically to make sure neither one got the chance. He spent roughly a week in that hospital bed, all from a sneeze he never even let happen. The good news, he healed completely. Doctors checked in 2 months later and gave him a clean bill of health, no lasting damage. And in fairness to your own nervous system, this is rare, genuinely rare. Most people who've pinched their nose through sneezes their entire lives will never tear anything. The specialists who published his case weren't trying to start a panic. They published it so other doctors, and now you, would know exactly what's possible when this goes wrong. Rare doesn't mean impossible. It means it already happened to someone, and it can happen again. We spend a lot of energy trying to look composed in front of other people, muffling coughs, faking a calm face, holding in anything that feels embarrassing. Most of the time, that costs you nothing. This is the one time it actually can. So here's the actual takeaway, and it's almost embarrassingly simple. Your body already solved this problem. It built an entire system to clear irritants at full force, safely, through the exit it was designed to use, your open nose and mouth. The fix was never sneeze in public. It's just, don't seal both exits at the same time. Sneeze into your elbow. Muffle it if you have to. Just don't trap it. So next time you're in that silent room and you feel the tickle building, let it out. Your throat, your eardrums, and apparently the tiny bones inside your ears will all thank you. Now that you know this exists, are you still pinching your nose next time? Tell me in the comments.